Hello, and thank you for joining us for the North Carolina Medical Society Candidate Series. We've invited all of our members who are running for state or federal office to join us here in Raleigh and talk about their campaigns. Today I have Dr. Grant Campbell, who's running for North Carolina House District 83. I want to make sure I got that right. Thanks for being here.
Thank you for having me.
I want to start with what has motivated you to do this? Why are you running?
That's a good question. I think for me, there's always had to be a component of service in my whole adult life. You know, I kind of fell in love with America by being someone of humble beginnings that was able to make it. And so I felt a debt for that. So whether it was serving my patients or serving my country, now that part of my career is over and I'm looking for a way to serve my community.
Well, then let's go ahead and talk about community. We live in North Carolina and you're a physician here, and I'm sure you're aware there is a large rural component to the state of North Carolina.
Yes.
And those people living there have trouble getting access to care. If you win, if you're elected, what do you think you could do legislatively to help that problem?
Oh, you're singing my song. I grew up in rural North Carolina. My district is mainly rural North Carolina as well. And there's a two-tier health system, rural and metropolitan. I think there's several things we can do. And I'm not saying that some of the things that we've done so far have been ineffective, but I think that instead of totally rethinking how we do this, we need to broaden our scope. Now, I'll give you an example. In order to get more physicians to rural areas of the state, we've always had things like loan repayment and things like that. And it's been great. I'm not complaining of that at all. But I think we also need to shift to look at ways to help those physicians grow roots in the community. Because what we don't want is someone to see it as, this is a 4-year term. My loans are going to get repaid and then I'm going to move on to somewhere else. Let's look at other possibilities about low-cost loans to build a practice, low-cost mortgages, things that ingratiate them into the community, become part of the community where they're not just a visitor, but they're a citizen of that area.
And I'm glad you talked about community, because something that happened late last year was Medicaid expansion, which got health care to a lot of North Carolinians, 600,000 roughly, now available or possibly can be on Medicaid and get access to health care. It was a historic piece of legislation for the state, but my question is, what's next? What do we do now that that has happened? What's the next piece of this puzzle?
Well, and there's several pieces to that puzzle. I think one, there is going to be a greater demand for physicians, and we've got to look at expanding both medical school admissions and residency spots as well. Now, that's going to be a state and federal level, but there are things that we can do as a state to kind of increase that pool that we draw from for providers for the state. Now, the other thing that we have to think about is with Medicaid expansion, I'm a former military guy. I'm all about what's called after-action reviews, where after you do something, let's look back on it and see if it's accomplishing what we say. And one thing that I think that we need to look at over the next couple of years is that healthcare systems and insurance companies have said, well, we're bearing this burden of patient care with no Medicaid, no insurance, no Medicare, and it's being debilitating in the cost that we're incurring. So I think one of the things we're going to look back on is say, okay, we have now passed this for you. I would like to see commensurate drops in insurance rates. I'd like to see commensurate drops in charges to patients for hospital services. So I'm kind of big on, instead of passing legislation and wiping your hands and saying, okay, we're done, good job for us, let's keep on this over the next several years and say, is this accomplishing what we said? And if something's dropping off, then we find out why. Okay, how do we fix this? And if it's someone that asked for this, but they're not doing their part, we need to call them and have a sit down as well.
Well, you were talking about hospitals, and I'm going to lead into insurance with this, because something a lot of our members asked about, and something that we are taking very seriously here at the Medical Society, is prior authorization. A lot of our members see it as a problem.
Yes.
And as
do I.
and a roadblock to getting good care.
Right.
Let's just, same question. Do you see it as a problem? And if so, legislatively, what do you think we can do about it?
Yes, I see it as a problem. Now, legislatively, we have made some progress with that in the last session. But prior authorization, I understand, I'm not asking for everything to be on formulary.
Mm-hmm.
I understand sometimes these things are discussions that need to be had. But it needs to be a true peer-to-peer that's reviewing this. It needs to be simplistic. It needs to be on time. And if you do have to have a peer-to-peer conversation instead of a form, it needs to be someone in your specialty that's board certified, that is still practicing medicine, that understands what you're trying to do for patients. And I think there needs to be teeth for not following that. If insurance companies, I'll give you the perfect example. Okay, you have to do a peer-to-peer review. Okay, and we've set you up. You're going to call in at 3 o'clock on Tuesday to get this done. And you'll get a call in the middle of patients at 1:45. Well, this is the only time I can do it, so we can do it now or we can't do it at all. Or I call in at 3 o'clock and no one's available. There has to be penalties to that, because in the end, we're trying to get the best treatment for our patients. I don't get any bonus for prescribing one thing versus the other. I'm just trying to pick what's best for my patients. I know that this process can't go away completely, but let's make it logical, efficient, and streamlined.
So you just mentioned trying to get the best care for your patients. And I know that there's no crystal ball. There's no looking ahead. You don't really know what's happening, but there's a lot of stuff in the pipeline that could affect healthcare. Things like AI, telehealth, more mental health services, a lot of things in the healthcare sphere that seems like right in front of us that we're going to have to adjust and learn more about.
Sure.
Last question. When you look forward, what do you see with the future of healthcare here in North Carolina?
Well, let me take those in a little bit different order than you gave me. I think one of the biggest crises we are facing right now is inpatient mental health capacity. And there has got to be legislators have got to be a partner in that and to help get that. I'll give you the example. When I first started practicing medicine a long time ago, when I would have a consultation in the emergency room, it would be a rare occurrence where there may be a patient there for what's called a psych hold, where they need inpatient psychiatric care and they're waiting on a bed, and they may be there for 12, 24 hours and then they get there. It is not uncommon now to go through our emergency room, and a third of the emergency room capacity is psych hold patients that they're not getting the care they need. It's a safety issue for the staff. It's diminishing the emergency room's ability to give care for other conditions. We have to expand that, and I think the legislature can be a partner in that. So that's one. Telehealth, I'm excited about for certain things. I think that there are ways to expand access of care for specific things. You have to be very careful about what you're using it for. I do have concerns about telehealth being an issue for antibiotic resistance issues, overprescription of that. My other concern is I don't want to take second-tier care options, push it out to rural communities, and we wash our hands and say, we're getting them the same thing. We need physicians present, telehealth when appropriate. AI, I think it's a great frontier, and I think that we're already seeing some promises in terms of treatment algorithms, especially in oncology and cancer care, decision tree type analysis. The rest of it, I say there's nothing wrong with being careful. Let's put the brakes on the other things. I'm all for anything if you've got the data to show me that it works and it gives better patient care. Now, I'll give you one more that we didn't talk about yet.
Okay.
Opioid crisis. This is an incredible issue. It's disproportionate to rural communities. I think that this is going to take a medical and a non-medical approach. And I think the legislature, where we need to do is we need to get the tools for providers for what they need. And then we need to address some of the supply and demand issues that are outside of healthcare, because this is a bigger issue than most people understand, and we've got to be partners in that as well.
Okay, thank you very much, and appreciate you bringing that up. That's another important subject. If anybody wants to learn more about you and your campaign, how can they find out?
www.campbellfornc.com. That's fornc.com. And check me out. If you have any questions, send us a message.
All right, thanks so much for joining us. And you too, thanks for joining us for this edition of our candidate series. We'll have more coming up before the election.